to raise awareness and reduce the stigma surrounding addiction, and how we can improve our entire community by being uplifting and having those positive messages, and to have to try to find creative ways to address something that's been around forever. And that was what brought Emily into politics as a city council person. She became Hagerstown's first female mayor, and she actually you were the driving force behind Washington County Goes Purple, which is an awareness program, and that almost everybody kind of knows about now. Thanks to a lot to Emily's work and to how she has touched other people to bring them into the fold on this. And when Wes Moore was running for governor and he would come to Western Maryland, Emily would manage to be by his side because she was the mayor. And she was constantly planting a seed with him. Now, the state of Maryland had lots of programming to address addictions, treatment, and all of the complexities that go with that. But Wes Moore saw something a little special in Emily, and he created a position. She is the Special Secretary of Overdose Response. I always have to look at it to make sure I'm saying it right. It's not that those programs didn't exist before, but now there's somebody who really has an emotional stake in it. She's become an expert, a subject expert in the area. And Emily now works with every county in Baltimore City to raise the many, many issues. And when I read an article that there were some, everybody thinks, oh great, just another special commission. Well, this one's had results, and I thought it would be good for us to hear about those results, and that we need to be the people who are telling the story in a broader area, and helping Emily with the goals that she have been held so close to her heart for so long. And we are very, very honored to have you here, Emily. I'm honored to know that she's a hugging friend. And thank you, Emily. Come up. We can't wait to hear from you.
Hi, good afternoon, everyone. Good afternoon. So, thank you, Rachel, for that introduction. Thank you guys for having me here today. It's nice to be home, and you guys gave me an excuse to work from home today, so it's like a win-win over here. Thank you again, and I'm here to talk about the overdose response efforts for the state of Maryland. As Rachel said, I'm the former mayor of Hagerstown. I live here, I'm invested here, I have a daughter that goes to school here. I love this town, and I loved my best friend Ashley as she struggled with substance use disorder for years and years and years. And what I learned through her addiction was that our system was failing. It was failing 10 years ago, 15 years ago. We were treating people who had a substance use disorder like a criminal. Ashley wasn't a criminal. She wasn't hurting anyone but herself. She was hurting herself. She needed help. And instead of offering her treatment or solutions, we were throwing her in jail. And then she would get out of jail, and she'd come right back out and get right back to the same substance use disorder because she was sick, she had a disease. And I watched our community, the state of Maryland, the country, really look at this as a moral failure or a parenting failure instead of looking at this as it has been described since the 1960s, and that is a disease. But it's the only disease that we treat this way. If someone has high blood pressure, what do? They take blood pressure medication to fix it because they have a disease and there's a medication for it. If someone has cancer, they go through chemotherapy or radiation, they receive treatment for it because it's a disease and there's a cure for it. But with substance use disorder, we haven't looked at it the same way. Even though there are medications to treat substance use disorder, there was still this huge stigma around it. And I just thought I really want to do something to help. So I'm not a doctor, I'm not a pharmacist, I'm not a clinician, I don't have a bunch of letters beside my name. In fact, I don't have any letters beside my name. But I think that that's given me a unique perspective because I have to work with all the doctors and all the clinicians and all the professionals to help kind of make sure we're all singing from the same sheet of music. And that's exactly what our office does, the Maryland's Office of Overdose Response. We go by Moore. That was not intentional because of Governor Moore, but it is what it is. Just a little bit about our office before I get into where we're at as Maryland and what you guys can do to help. We are the coordinating body, so we work with all 24 jurisdictions, including Baltimore City. We have overdose prevention teams in every jurisdiction. So that's health officers, fire, police, clinicians, harm reduction specialists, and we have members of our team that attend all of those meetings every single month to hear best practices, to hear what's working, what's not. We also grant money, and one of our biggest tasks right now is our office oversees the opioid settlements. So you guys are probably well aware that Hagerstown, Washington County, the state of Maryland, and close to 3,000 entities over the country have sued the pharmaceutical companies for their hand in this epidemic. If you guys have read any of the court proceedings, they are tragic. It is absolutely tragic. Purdue Pharma hired thousands and thousands and thousands of people to push OxyContin. And now they are having to pay the damages for this crisis that they helped create. So the state of Maryland is getting, as of right now, close to $650 million over the next 16 years. That number is continuing to grow as some of these settlements are settled. So our job now is to make sure that that money, because it's blood money, quite frankly, is used to remediate the opioid epidemic and the overdose epidemic. And we're looking back past history, the tobacco settlement. I think a lot of people in this room probably remember that. Some jurisdictions bought things like trash trucks and ice rinks and things that had absolutely nothing to do with tobacco remediation. So it's our job to make sure that that doesn't happen here in the state of Maryland. I did just want to talk numbers briefly. I'm not going to bore you, but I did put them on my phone so I get them right, because I think this is very important to see where the state of Maryland is at, because we really are at a crucial time. The good news is overdoses are decreasing, and they have decreased since 2021. So preliminary data for 2024 shows that there were 1,765 fatal overdoses in Maryland. That's a 29.7% decrease from the year before. It's the largest decrease that the state of Maryland has seen since we began tracking these numbers. That is a huge deal, because that's almost 800, 900 people that we did not lose last year compared to the previous year. I hate talking numbers because each one of those 1,795 numbers were people. They were parents and loved ones and aunts and uncles and our friends. And so I think this goes to show you that what the state, what the country is doing, it's working. It's working, thankfully. Substances, I'm sure this comes as no surprise to anyone, fentanyl is leading the way. There's been a wave in the opioid epidemic. It really started with prescription pills that were legally prescribed. It then transferred into heroin. Heroin became fentanyl. Now we're seeing fentanyl that's adulterated with other substances like xylazine and whatnot. But heroin has really, as you can see up here, there's really not a lot of heroin left in our drug supply, which people think they're buying heroin, they're not, they're buying fentanyl, and that's what has caused a lot of the deaths. But thankfully, that has decreased. And cocaine is second in the state. A lot of people don't realize that. Cocaine overdose deaths are still very high, and right now we're seeing cocaine mixed with fentanyl. So you have people who have habitually used cocaine their entire lives, or part of their lives, that think they're buying cocaine and they're not. Same goes with college students. People don't like when I say this, but it's the truth, right? College students you go party, recreational drugs, think you're doing cocaine, think you're staying up to write a paper, has fentanyl in it, they end up overdosing. It's horrific, quite frankly. Race and ethnicity, I think this is where Maryland has really failed. There's a huge racial disparity between white and black people when it comes to overdosing and dying. We know white and black people don't use drugs at different rates. They use drugs at the same rates. But over the last several years, we've seen that black people, especially black males over the age of 55, are dying at a higher rate than the rest of their white counterparts and about their age groups. And a lot of people always talk about underage overdoses. We're seeing the Hispanic population under 25 is experiencing a lot of overdose deaths. The good news is that this age group, 25 and under, is still using drugs at a significantly lower rate than higher age groups. But the racial disparities still very much exist. There is a racial disparities work group in the state of Maryland that's working directly, specifically with Baltimore City, since we're seeing it the biggest there, but across the state to see what we can do different to drive those numbers and why 55 and older. I mean, it is a pretty drastic. I say that and everyone kind of pauses, because when we think about someone who uses substances, our mind doesn't always go to 55 and older, but quite frankly, they're dying at a higher rate than most. So our office is doing the strategic goals for the state, and this is where everyone can kind of come in and help. We have 5 priority areas. They're prevention, harm reduction, treatment, recovery, and public safety. So first is prevention. We want to interrupt pathways to substance use. So this are things like the Going Purple campaigns. Rachel talked about Washington Goes Purple. There are Going Purple campaigns in 23 out of 24 jurisdictions now in Maryland, which is really cool. It's a prevention effort. It's aimed at kids. We're thrilled to see that. It brings awareness to what is going on. And we need to do more to address childhood trauma in ACEs. If you look at a lot of people who use drugs or experience mental health, it was things that happen in childhood. We need to make sure the social determinants of health is such a big factor. If you don't have stable housing, if you don't have food, if you don't have stability at home, if your basic needs aren't being met, how can we expect people to thrive? And for so long we were looking at drugs as just drugs, but there's so many other underlying issues that can lead there. So we're working really hard to address those, and that's part of our state strategic plan. We do have partners at the Department of Labor, the Department of Housing. 19 state agencies actually come together every 2 months in a committee, and we report back as to what they're doing. So it's truly all hands on deck. Public health approach, but it's got to have everyone at the table. Our next is treatment. I think it goes without saying, but no matter what your circumstances, no matter where you are in this state, no matter where you come from, we want to make sure that you have the treatment that you need. Period. So if you need to detox from alcohol or opioids, we want to make sure there's a bed available. If you need inpatient, outpatient treatment, whatever it looks like. And then this access to MOUD, that's medications for opioid use disorder. I alluded to it earlier, but things like methadone, Suboxone, or buprenorphine, they work. They are the gold standard for substance use. People who have a substance use disorder, opioid use disorder, and get on medications are significantly more likely to stay in recovery. But for some reason, there's still this really big stigma around methadone and buprenorphine. Doctors don't like to prescribe it. People see methadone clinics and think, oh, why would you go stand in line? It's saving their lives. So this goes back to that stigma. As we have medications that work, we want to make sure everyone has access to them. And part of that is in our public safety slide, which I'll get to here. For recovery, we want to make sure Maryland is the most recovery-friendly state in the country. We are doing so by a partnership with the Department of Labor to make employers recovery-friendly. That means if you know how to recognize with your staff if someone may be experiencing a mental health crisis or substance use disorder. That means maybe adjusting the insurance policies to make sure things like treatment and medications for opioid use disorder are covered. And also overdose response, how to recognize signs of an overdose, to make sure staff has access to naloxone or Narcan, how most people know it, which is an opioid reversal drug. Also for the recovery friendly, we're changing the state's policies because we can't be hypocrites. If we want everyone else to be recovery friendly, the state of Maryland is going to be too. So Governor Walz, who ran for vice president, his state just became recovery friendly. We're looking to do the same in the next legislative session. Next we have public safety. We know public safety officials are often first to respond when someone is in moments of crisis or experiencing an overdose. So we want to try to avoid the criminal legal system and help the people who are already involved. So the state's really taking the approach on LEAD, law enforcement assisted diversion. And what that is when someone has a run-in with police officers, if they're a low-level offender, trespassing, things that we're seeing all the time that may be considered nuisance crimes, giving that person a charge which affects the rest of their life as they're trying to seek employment or trying to seek treatment or trying to get housing is not always the best route, and quite frankly it hasn't worked. We wouldn't be here if locking people up worked all the time. So we're trying to look for alternatives to that, whether that be they check in with the health department, they have alternative responses like treatment programs, whatnot. Also, we are doing medications for opioid use disorder for people in carceral settings. So if you're incarcerated, now in the state of Maryland, you do have access to things like methadone, Suboxone. The reason for that is one of the highest rates of overdose deaths were people returning from incarceration 2 weeks after they got out. Because they were using drugs prior to being put in jail, they got out, they were not treated while they were in jail. They got out, went back to that same substance, and were dying very quickly because their tolerance wasn't the same. So now we're starting treatment in jails, which allows them to continue that medication treatment when they are released, and we're seeing really, really promising good results from that. It's decreased recidivism rates, and it's decreased overdose death rates, which is, in my opinion, the most important. We have to keep people alive. The last part of our plan is harm reduction, and this is one I really wanted to talk about. I read the articles here locally and across the state. Harm reduction can be very controversial, but quite frankly, it works. So the number one way we do harm reduction, and what Maryland has really led the country on, is making sure everyone has access to Narcan or naloxone. It is a nasal spray. I'm a total hypocrite because I always carry it with me and it's in my car, or I would show you. But it is, if you've ever used Afrin or any type of nasal spray, allergy nasal spray, that's what it is. If you see someone that you believe may be witnessing an overdose, then we ask that you administer the Narcan in their nostril and call 911. There are laws, the Good Samaritan laws, that protect you from doing that because you're acting in good faith. And the really, really good part about Narcan is it doesn't hurt somebody. So if that person isn't even experiencing an opioid overdose, if they're experiencing a heart attack or diabetic shock or anything else that could possibly look like an overdose, and you administer Narcan, there are no adverse reactions to it. So the worst thing you can do is nothing. The best thing you can do is save somebody's life because it was indeed an overdose. So we want to make sure everyone has access to that. Another harm reduction tool is syringe service programs. You guys know we have one in Washington County. We actually have one in at least one in every single jurisdiction in Maryland, with the exception of one county that is coming on board. Some counties have multiple, but this is where you go, you're greeted with a peer support specialist. So this is someone with lived experience. If someone who has experienced substance use in their life, they are licensed and trained to talk to people. So they walk the walk, talk the talk. They've been there. They don't judge. They treat people with dignity and respect, and they say, what do you need today? So sometimes this syringe service program, the person just needs a place to sit and maybe a snack. A lot of times it's clean syringes. They may need access to Narcan. They may need cotton swabs and tourniquets, things that I think in the past we kind of looked at as, is this enabling? Well, I don't know about you, but if someone came in here right now and gave me a clean syringe, my first instinct is not going to be, let me go try heroin for the first time, right? These are people who are already using drugs, and it's our jobs as human beings to keep them alive and keep them safe for if and when they're ready to get treatment. I think the underlying thing with this issue is that we have to keep people alive. And by providing a clean syringe, it helps them decrease their risk of HIV, it decreases the risk of hepatitis. We've actually seen those numbers decrease drastically in the state since there have been syringe service programs. And that's not just for people who use drugs, that's for people who don't use drugs either, because people who use drugs have relationships with people who don't. So it truly is a public health effort. Also, that peer-to-peer interaction, when that person goes and receives those services, and they're not looked down upon, they're just treated like another person coming in to seek medical treatment. When they are ready, if they're ready to go get treatment, they already have that trusted resource. They have someone that they know they're not going to be judged at, and people who participate in syringe service programs are over 400 times more likely to seek treatment. That's a huge, huge number. Over 400 times more likely than someone who does not engage in those services. So I encourage you, if you hear people's frustration with the fact that their health departments are giving out syringes, and they are giving out Narcan, and they are doing these things, to realize that it truly is a life-saving tool, not just for the person who uses drugs, but for our community, for disease purposes and everything else. Now, I think a lot of the concern is over needles. We hear all the time, oh, I saw a needle on the street, or we see the incredible do-gooders that are out cleaning areas in our city, in our state, and posting pictures online saying, look at all these needles we got. And it creates a feeling of, well, that's really scary. And I agree, right? They give out sharps containers. We want people to properly dispose of them. But also without that program, more people would be dying. So I ask you, everyone, and as you talk about this subject or you hear about it, to open your mind, because I know this is something that it's new and it's scary to some people. And like, I live in this world, you live in this world. So like, it's just kind of like second nature. It's, hey, we're helping people. But if you don't, I can understand why people are reluctant to jump on board, but the numbers show that it's working. The disease levels show that it's working, and that's so very important. And it's saving people's lives, and I think we're seeing that in the numbers as our contact information. But there's a lot of work being done in this area. There's a lot of things that we're not doing right and that we're working on all the time. I think the good thing about the state, what the state's doing right now, is we are approaching it from all angles, because we recognize we need harm reduction. We recognize we need police officers. We recognize that we need the doctors, and we need people with lived experience, and we need people who use drugs to trust us. So I'm comfortable going in any setting, in any place you put me, in any alley in Baltimore City, and I'm comfortable talking to people who use drugs because I'm just used to it. And because we have to have buy-in from them too, you know, that approach of nothing about us without us. So if I'm making decisions trying to save somebody's life, I need input from the people whose lives I'm trying to save. And I think that's something that Maryland has done well, build those relationships. So we are looking for partners all the time. We're looking for places that we are missing. The Lieutenant Governor has an interfaith council that she put together that is meeting every 2 months right now. They just did an anti-violence summit on how places of worship can help in the violence space. We are looking to recreate that in August or September for overdose issues, because we recognize that you guys reach an audience that we may not. And you have a different relationship with the people who visit your places of worship that we may not be reaching. So if we can engage the faith-based community, we can do even more great work. So I will certainly make sure you guys get an invitation to that when it happens. We have some best practices coming in. There's a church in Baltimore City who's actually allowing someone to come in and provide medications for opioid use disorder during the week. There's actually a church in another jurisdiction who's providing syringe service programs out of their church. They're allowing someone to come in. So that's outside. I was surprised when I heard that, but just as outside of the box, thinking of what what different role can we speak? Even just verbalizing like, hey, it's okay that you're not okay, and I'm here when you want to talk about it. I was in Nashville a couple weeks ago at a drug summit, and they had a class specifically on how to engage the faith-based community. And there was a pastor that was speaking who was saying, you know, he always felt like he had a great relationship with the members of his church, and then he found out someone who he had a good relationship with died from an overdose, and he was shocked. And then he realized that he reflected back on that moment and maybe never said, it's okay if you're not okay. It's okay to be using drugs, but we're here when you want to talk it out. And he carried a lot of guilt that he never verbalized that. Mm-hmm. So I think people just want to hear, you know, people who use drugs look like me, and they look like you, and they look like all of us. So you never know what's happening in someone's house, and we want to take captive audiences when we can and let them know that there are people here to help. So there's a lot of good work being done. I know it's difficult sometimes when you look out and you see things that make you feel uncomfortable, or you see people who are struggling, because we see it. We see it when we're downtown. I see it as I travel all over the state, no matter what part of the state I'm in, rural, suburban, it doesn't matter. So it can get discouraging because you feel like there's not enough being done. And there's more that we can do, but there really is a ton of people out there working hard every single day to try to provide the resources and fill the gaps of what we're missing. So it's a little bit as to what the state has been up to. I would love to kind of answer any questions or comments or anything.
So over the years, I've talked to recovering addicts here and there. Usually they'll say that at some point when an addict can be treated or be helped, they have to want to take that step. You can offer all these resources and services, but speaking from experience, they'll say you have to want it, you have to be open to it, you have to be ready. Is there a way to get people to that point? Because I've done a little tried to offer help, or can I do this, can I do that? And typically it's like, oh yeah, but they want money, or it's yeah, I know that, I've been to that place, or so you feel like there's a wall, you can't really get through it. There's nothing like reaching out saying, please help me. So what do you do? What can you do?
If you can solve that problem. There's no easy answer to that, right? Because you're right, if someone doesn't want help, they're not gonna get it. And
right.
we know forced treatment does not work. Like the numbers for years and years and years show that. Jailing people does not work. Forcing them into treatment does not work if that person's not ready to get help. And you can love someone, if love would have saved Ashley, she would have lived forever, right? Because we all wrapped her in love, and she was not ready. It's very frustrating, especially when it's someone that you love, or even someone that you know. But just being that trusted voice, saying I'm here when you're ready. I can't tell you how many times I say that to friends that I know, to people who I meet, I'm here when you're ready. And that's why some of the other tools of keeping them as healthy as possible while they're using drugs is really important. And just making that non-judgmental connection of like, I'm here when you're ready. Because it may be the 116th time you've told them that, but the 117th time may be the time where they're like, you know what, I'm ready. And you never know. And that scope looks different for every single person. And there are some people who will use drugs for 10 years and say, I don't want to do this anymore. And it's that simple-ish for them. There are some people who use drugs for a month and want to stop and just can't. And there are some people who use drugs who just don't want to stop yet. And so I think providing a safe space and saying that, if and when you're ready to get treatment.
I mean, knowing her as well as you did, do you know now what kept her? I mean, was she just so addicted and needed the fix that, was she aware of how bad it was, or not aware, in denial? Like,
She was aware.
Yeah.
She wasn't using drugs to be high anymore, she was using drugs to be okay. Like, that chemical dependency, withdrawal is horrific. If you guys have ever seen anyone withdrawing from from drugs or alcohol. Alcohol withdrawal is equally as bad as opioid withdrawal. It can kill you. It's extremely painful, it's extremely uncomfortable. And so when someone has used drugs for a long time and they go without it for even shorter periods of time, they are miserable. And a lot of times they're just using to not feel like that. And that was the case with her. And when she was ready back then, there wasn't beds available close enough. Now that is one hurdle that Maryland is finally over. If someone stood up right now and said ready to go to treatment, we can have you in a bed. That is like an extreme advance thing that we've gotten finally.
I'm very pleased to hear that the state is also bringing in the faith community, which is why I thought it would be great to have Emily here. We have a little PR problem still with the stigma, and I mean, I live in a neighborhood where I see people that are, you know, in the grip of substance abuse, and we need a little PR campaign of we are all made B'Tselem Elohim, in the image of God. We are all worthy of love from one another, and this removing the, it's just, it's hard for me to understand at this point when it is an epidemic, and I don't know anybody who isn't affected in one way or another. And we've got to remember, and it's hard in this particular political climate, to give each other grace, even when we disagree. And I disagree mightily with somebody who is abusing opioids or anything like that, because, and you know, you asked her, did Ashley know? They know. They know. And they, I mean, I know not eating too much is not good for me. But it's incumbent upon us to help remind people that are quick to judge that we are not the judge and jury here. We are here to love one another and be there when somebody is ready, to get that particular demon out of their lives.
Something that always stuck with me was a parent was talking to me about their child who had been using drugs for a long time and had just gone into a treatment program. And they said every time I would get frustrated, I would look at them and realize they're still in there.
Yeah.
And that's always stuck with me. They're still in there. You know, that was a little boy or a little girl who had dreams one day. They may have wanted to be a singer or a basketball player or a doctor or whatever. That person is still in there. And, you know, we all fight battles different. We just look at drug use as different, right? How many of us, I won't ask you to hold your hand up, but I will, have gone home after a tough day and poured a drink, right? A big old glass of wine or whatever it is. Or you get frustrated and you go through McDonald's and you eat a triple cheeseburger because it makes you feel good and it gets those endorphins up and it tastes good. You know, we don't look at that. That causes all kinds of diseases. You know, people smoke cigarettes. Cigarettes was, you know, for the longest time was really socially acceptable. I think we're starting to see, you know, a descent away from that.
Chocolate and sugar over here.
But yeah, chocolate, sugar, you know. Yeah. We all handle things different. Some people throw themselves into exercise. I envy them because you would have to pry me out of bed to get me to go to the gym at 5:30 in the morning. But some people, you know, they immerse themselves in different things. Not all of them are always healthy behaviors. You know, how many, there's sex addicts, there's food addicts, there's all kinds of things that we do to ourselves to make ourselves feel better. But for some reason, drug use is like the only one that we're not really all accepting of yet. And so I think to just realize that that person's just trying to get through life like all the rest of us, and the habits that they have to deal with it are maybe different than the habits that we have to deal with it. That's just how it is. But stigma is killing people.
Mhm.
And you know, I applaud the people who are recovering out loud. I said that the other day. I think the coolest thing my generation right now is doing is saying I'm a person that used to have a substance use disorder and I'm in recovery. I have so many friends on social media who are like, day 100, day 1000,
right.
you know, day 895. You go back 15 years from now, people didn't do that. Alcohol Anonymous was anonymous for a reason, right? And now people are like, I'm 28 years sober from alcohol. I'm 10 years sober from cocaine. I think it's a beautiful thing because it's humanized it. It has humanized it. Like, we're all fighting battles. It's just saying it out loud has been hard.
Well, if I say I'm 40 years clean.
Yes, congratulations.
Yeah. From the 70s and 80s, you know, matter of fact, I went through a whole spill like I was telling them at the table, you know, even Judge Judy was my last resort. And I think I made her TV show, honestly, because of the way my habit was and the way they was trying to get my life together. And they seen the good in me. I always did a lot of good. I worked with the mayors. I worked with always helping in the community to uplift people. And they knew that if I got clean, I knew if I got clean, it would be. But it was through trauma. You know, it's through family hurts and pain and things that happened that people never talked about. And people didn't explain to you, you know, like the things that you went through, why you was abused as a child, why you got kidnapped when you got into certain ages. Things happened to me, you know, and it kind of like made me like drift away from it, not really thinking about things. I never got to Orport. I'm glad I never got to Orpoids, but I do help people that's been there because you have to get to the place of becoming your best self in everything. You know, I raised 7 kids. I was about to lose my kids. Bree wasn't born then, but you know, I had 6 of them at the time, and I had a friend's child that I was raising as well. But I had to get my life together because she told me to get my life together for me, not for them. And that meant a lot to me, you know, and it was programs I went to. I went to Daytop Village. I went to Project Hang In. Matter of fact, I wrote the philosophy for Project Hang in Harlem. I made a difference. Even, you know, when my life changed, the police was like, if you could change, anybody could change. You know, and I just thank God, you know, because I had experience with him. You know, people kept telling me about Jesus Christ and how he could save you, how he could deliver you. And I had to really go in deep and believe that he could save me. He could deliver me from anything that was taking me out of the content of my human self, of who I was for real. So I just thank God for that, and I try to help people as much as I can. I've been here 2 years, and I really want to help. I see a lot of problems out here. You know, I just say, we open a big place down in the Midtown. I want to be in the middle just to have people come in, you know, and talk with them. And, you know, because you'd be surprised of how you can reach somebody if you just talk to them in their sober minds. Like, you may see them regular getting high, but they have a sober day because they live in the same community. And that's how in Harlem, when they swept Harlem and changed Harlem, and today all of those people are in college, got their masters. You know, I developed the gift of leadership and evangelism and things like that. You know, like, it's just how you perceive the situation, what's going on in your community, and how you really want to reach out and help. Do you really want to put a team together? Do you really want to, you know, help that person that you see maybe need some clothes? Regardless of whatever they're doing, they need some clothes, they need some food. You know, they just need somebody to instill some love from your heart to theirs. And that's what happened that changed my life. The love of Judge Judy really changed my life. I mean, she was hard, but she was hard. Oh my God.
Did you meet her, or did you just
She
watch
was
the
hard.
show?
Huh?
Did you know her?
Yeah, personally, she was my judge before she had a show.
Oh,
Yeah. At 60 Lafayette in Manhattan, New York.
Oh, wow.
Yeah, so, because I was in an abusive relationship, I was in a lot, and it just was things that was going on. I mean, she wanted to put me away for 2 years, but I hid, I kidnapped my kids. I did a lot of things to really, and then I realized this thing was coming to an end, you know what I'm saying? And we gotta help people before they die, before they clock out. I lost a lot of friends to them using cocaine. I mean, they got HIV, I could have been a villain. I could have been one of those people in the mix of that. But I'm thankful. I'm not afraid to tell it. I mean, God saved me. He healed me. And I'm not ashamed of anything that I ever been involved in because it only made me stronger today to help people. Yeah.
Thank you for sharing.
Two things. I know it has to do with the cost and the time and the volume of people. But people turn to drugs because they've got problems. But we don't have any psychotherapy, we don't have any counseling for it, and they just go to drugs because they hurt too much. And we rely too much upon the pharmacology to save us and maintain us. Whereas you point out, we in this room have the only answer that will set you free. And yet we cannot bring this up in the public forum. Because if you want to say Big Pharma has its own thing going and everything else, it's cheap. We don't treat the whole person, body, mind, and spirit. We just teach, we treat the body, and the psychiatrists are who can write the scripts. I mean, there's 72-hour frequent flyers going back and forth. We're putting band-aids on fractures instead of increasing psychotherapeutic interventions and reaching out and spending time letting people know they're not alone.
Yeah, there's an extreme lack of clinicians and doctors in the mental health field in this state and across the country. I will tell you, conversations outside of my department that happen in behavioral health administration, they've done surveys like, why are people not seeking this field? Why are they not pursuing degrees? Why are they not staying in it? And there's going to be more work done that's incentivized people to go into that field, because that's the thing. People talk all the time, we need more crisis centers, we need more crisis workers. I wholeheartedly agree, right? But who's gonna staff them? Like, there is a shortage there, and quite frankly, with the budget cuts that we are anticipating happening over the next year or two, it's gonna get worse. It's gonna get worse.
Our time is getting short, so I'm going to reserve a last question when Kathy is done.
Sorry, Rachel, behind you.
Sorry.
Just raise my hand.
Yeah.
We've talked a lot about treatment. We've talked a lot about that. If you could touch on a little bit of what's happening with prevention. You touched on a little bit in your talk about ACEs, about adverse childhood experiences, about trauma, and how that really affects people to want to turn to drugs. What is the state doing as far as prevention, and how can we help with that?
So there's an entire committee for trauma-informed care right now, because we've really missed the mark there. We are trying to treat people who have already been through massive amounts of trauma, and that goes to meeting their basic needs from food and healthcare and housing and everything else, but also what's going on in homes, what's going on in schools. So there's a massive amount of effort being done to address that, specifically ACEs and trauma, and how do we make sure that the kids at school have resources that they need, that they have counselors, that they have certified people who are trained to deal with what they are dealing with, and also just prevention and having honest conversations with our kids. They know what's going on. I promise you, they know what's going on. And there's topics that for us, I have a 17-year-old daughter, right? She knows more about drugs than most adults because she's got to deal with me as a mom. But, but prior to that, I have always spoken to her like she was an adult when it came to things, risky decisions, and the consequences of that, because she knew what was going on. And there's a lot of pushback with drug education specifically, even sexual health education in schools, things that people, doesn't make you feel great, right? But they know. So just having evidence-based curriculum in schools at a younger age, and after-school programs, in places of worship, we know what works, we know the science behind it, and having the courage to give the kids credit, that they know what's going on and they can help each other, right? Because I can sit and preach to 10th graders all day, and they're gonna like drown me out because I'm just an old lady now, but like for in their mind. But when a 10th grader talks to another 10th grader, a peer talks to a peer, they get more from it. So like empowering kids and trusting that they can make great decisions, we just have to give them the tools necessary to know where to turn to and what to do. Those are all things that we're trying to do. We have a really good relationship with the Maryland State school superintendents, and they have representatives that sit on our overdose boards that report as to what they're doing and how we can further collaborate. So it's all about collaboration right now. All right, well, thank you guys.
Well, I'm gonna take my one last
Yes.
moment with you here. Emily shared with me, you shared with me some information that there is funding available to our county with the, help me remember,
Opioid restitution
restitution funds. How can we become your partners to take away the roadblock of the county not, I don't understand it, so I need you to explain it to us a little bit better, but what is this money, how come the county's not accepting it, and what can we do? I mean, I'm already thinking if I learn more about it, I can go to that 8 a.m. public comment period at a county commissioners meeting and hold them to account of why are you not accepting funding to make our county a better place to live.
So there is money. So the way that the settlements work, it's extremely complicated, but I'll make it as simple as possible. 100% of the money came to the state. 70% of that money goes directly to the people who sued. That means directly to the counties and the municipalities who were involved in the lawsuit. 70% of it. The requirement is we have the money for the first 2 years. It's sitting in our bank account. 20 out of 24 jurisdictions, 19 out of 24, one of those two numbers has submitted their abatement plans to us. So pretty much here's a broad outline of how we're going to use the money. We check it and make sure that that's allowable uses. It's going to opioid remediation. It falls underneath the settlement agreement of things that money can be used for. We deposit the money into the bank for that county or municipality. They do it, they report back to us in the yearly reporting, because it will be very public, and we will have a public dashboard that shows you your money at work, this money at work. The Washington County has not yet submitted their local abatement plan. I know that there's been a meeting or two about it. Most of the counties are consulting with their health departments and the people who are doing the work. The money does go to government because governments are the one that sued. So there were some misconceptions at the beginning that the money would go directly to the health departments. That's not the case. Some of them are just deferring the money to the health department. Some are creating big community plans. So we're waiting on a couple counties and jurisdictions to get those abatement plans. But if you have ideas for the money, I would certainly reach out to the elected officials. There's also the overdose prevention teams, which I talked about. There is one in Washington County. It happens at the Behavioral Health Office, which is Vicki Sterling. She is the Director of Behavioral Health here in Washington County. It's an open meeting. It is truly an open meeting. They have to advertise it. You guys can go, hear what's being worked on, where you think the money should go. And then I just encourage everyone to reach out to the commissioners and try to get a community plan on board, because this has to be, much like what we're doing, all hands on deck, it's got to be all hands on deck. So there is money that's available.
Okay, I'll be quiet now.
Thank you.
Thank you, Emily.
When I went to turn in our gaming grant to the Office of Grants Management, Maria, who's now Susan Buchanan of the Office of Grants Management, she's working on the abatement, so there's still time if you want, so it might be, reach out to both ends.
Yeah.
But she was actually working on it when I turned in the gaming, and they're looking at, they have to spend it within 3 categories or 4 categories or something. So they're in the process of working on it, but I don't know what the application will look like.
Yeah.
So it might be a second contact.
And I don't even know if they're gonna do an application. I mean, that depends on the county. We have had some jurisdictions that have taken, you know, like $100,000 and say, we're gonna take this and we're gonna grant that money out to different organizations. So if Reach wanted to hire this organization, they would put in a grant to the county. That does not have to be the case though. Like we've had some, Salisbury, which is very similar in size and demographics to Hagerstown. Like they're taking their money and they're using it in partnerships with all their partners on like a city plan, if you will. So it can kind of look different for every county. It just has to be a qualified use. So treatment, recovery, medications, all those things. So thank you guys.
Thank you.
Thank you.